Hi everyone, my name is Jenna DiBartolo and thank you for joining us here at Cooper. I have been an operating room nurse for 11 years. I've currently been at Cooper for over 3 and in this role as the director of the operating room for a little over a year. Michelle?
Hi, I'm Michelle. I'm one of the nurses at Cooper in the operating room. I recently assumed a manager role. I've been at Cooper in the OR for 3 years, and I became an OR nurse because I wanted to help patients during their surgical experience. Sometimes it can be the scariest moment of their life, but we try to make them as comfortable as possible.
So Michelle, what does it take to be an OR nurse here at Cooper?
To be an OR nurse at Cooper, I think you have to be detail-oriented, you have to be a good multitasker, and you really have to be passionate about caring for these patients because they're asleep most of the time that we're with them, so they really rely on us to take care of them.
Yep. Patient advocates.
Tell us about the OR opportunities at Cooper.
So here at Cooper, there's plenty of opportunities for operating room nurses. In the last 4 years, our surgical volume has increased by 34%. We also currently have almost 20 specialty services from cardiac to neuro to general surgery, robotics. We do a lot of surgery here. We're a level 1 trauma center and we have a diverse patient population. We also have currently 32 operating rooms. We, in the beginning of this year, have actually opened 8 operating rooms to create a same-day surgery suite. So that puts us at 32 ORs, and we will continue to grow. So it'll be a great opportunity for you to have a career here long term. I can't see us getting any slower. Why do you love working at Cooper?
I love working at Cooper because of the phenomenal teamwork we have. From the surgeons, the anesthesia staff, our nurses and techs, everyone works so well together, and you always know that there's someone to go to if you have a question or if you need a helping hand. There's always someone around the corner that is willing and able to help you. So it's very comfortable. So what qualifications are you looking for in these OR nurses that might apply?
For an OR nurse to work here at Cooper, you need to have a BSN, and we prefer that you have your certification, your CNOR. It's not required, but it's nice to have, especially after you get your 2 years experience.
And when are you looking to fill these positions?
Honestly, we're looking to fill these positions as soon as possible. We have different shifts available. Most of our OR nurses work 3 12-hour shifts. We have day shifts, we have evening shifts, night shifts. People work really well together. They rotate. They help each other with their call. It's a really good place to work. It's a lot of teamwork.
And what should candidates expect if they are asked to interview?
So if we ask you to come back to interview with us, you will hopefully come with your knowledge and experience. You'll talk about yourself and what you have done in the past, what surgeries you've done, what experience you have. Also, please come with a updated resume, and honestly, with any questions that you might have for us here at Cooper, and we would obviously sit and talk and discuss any other things that I've missed during this live chat. So what's the teamwork like in the OR?
So, being an OR nurse, if you haven't already worked in the OR at a city hospital, is a challenging experience, but very rewarding. Like I said, the teamwork here is irreplaceable. From when you go out and you meet the patient, you're working with the doctors and the anesthesia staff to introduce yourself to the patients, making sure that they're comfortable and aware of what's going to go on that day. Then when you get back to the OR, everyone is all together. Everyone's on the same page from the timeouts, throughout the surgery, and then waking the patient up at the end. Everyone is constantly communicating and making sure that everyone else has what they need. And then once the surgery is over and the patient comes out, then we do it all over again for the next one.
I would like to say that the rapport here is very good with our surgeons, with our staff. one of the reasons I absolutely love working here at Cooper is the support I get not only from the management team, but from the staff, the surgeons, any healthcare provider here works really, really well together. Like our saying is, one team, one purpose. We really step it up in the operating room. Everybody comes together, especially when we have traumas. People join together quickly. I've never seen anything like it anywhere else. It's really awesome.
What kind of opportunities exist for professional development?
So here at Cooper, in the operating room, we have plenty of classes that people take. We have different Cooper Learning Network things that people can go on and learn. We have, for example, Michelle, who was an OR nurse, has showed interest in becoming a leader, so she has taken on a manager role. We do like to have our members join committees and be a part of the change we want to see and how we want to grow in the operating room. So we encourage our staff to join committees. We encourage our staff to be a part of decisions. We really take that seriously in our engagement, and we take that passionately, and we hope that people feel comfortable to want to join committees and want to make change here, because that's what it's really all about.
And in addition to that, I would say a large amount of our staff are AORN members, that they are keeping up with the standards, with their journals, but also there's a lot of interest in attending conferences, and we do allot some money for conference fees, and so people can get out there and be the best nurse they can be.
And we also have opportunity for if you wanted to go back to school or you wanted to get more certifications, you have that ability to do that here, and we can help you with that.
What kind of experience do standout candidates have? And what would you want to see on your team?
So honestly, here in the OR now, we have a majority of our staff. Actually, we have a great variety. We have anywhere from new nurses who've only been here with less than a year to a variety of nurses who've been here for many, many years. With that being said, what we do look for are for nurses to come with some type of trauma experience. It's not mandatory that you have trauma experience, because there's a lot of opportunity for you to learn here. We have great preceptors, it's a great teaching environment. So if you come from a hospital or a surgery center, as long as you know how to circulate and even if you know how to scrub, we can sit and discuss all of that during your interview, and that would help us to decide what type of orientation we would set up for you. Some people might need a longer orientation than others, depending on the experience that you do have. We definitely won't turn you away, but we do look for people that have obviously operating room experience and who can, get in here and really, really learn. It's okay if you haven't done some of the services that we have, because we do have a lot, but we will teach you and we'll support you and help you, so you'll never be left, alone. So with that being said, thank you for being here with us today.
And if you're interested and want to learn more about the opportunities at Cooper in the operating room, you can click on the link in the description or write any comments below. Thanks for tuning in.
Thank you.